in giving your skin, your hair, and your eyes its color. So albinism is whereby your body produces less amount of melanin or no melanin at all. So that means your skin will not have that color that it ought to have. Your hair and your eyes, and we have talked about the signs. And this albinism comes with vision problems. It comes with vision problems. One of them is photophobia. And phobia, you know, it's fearing. So you fear light. Photophobia now means you are highly sensitive to bright light. Another vision problem, they call it nystagmus. And this is involuntary eye movements. I don't know if you have seen people with albino. Their eyes move rapidly, involuntary blinking and eye movements. And the other thing, the first condition you have talked about is photophobia. Photophobia, we have said photophobia. It is where you are sensitive to bright light. Other thing is called nystagmus. Nystagmus. And this is first involuntary eye movements. And the last thing we are going to talk about in vision problems is reduced sharpness in vision or poor depth perception. Reduced sharpness in vision or poor depth perception. So what are their health risks, these people with albino? And we're just going to talk about their risks. We'll later talk about how they can be managed. So the risk, of course, number one is sun protection. They have to protect themselves because now they lack that melanin on their skin. So lack of skin pigment causes a high risk of severe sunburn and skin cancer. So it will be important for them to wear sunscreen, to put on sunscreen, to have hats and protective clothing. Another thing, of course, they have to take care of their eyes. So it will be good that they have tinted glasses and they are examined regularly, that they can manage that light sensitivity and light challenges. So those are the major risks on their skin and on their eyes. But of course, expectancy, you having albino does not affect you, and even your intelligence, it remains the same. So that is albinism in brief. I will talk about vitiligo.
Does it have a treatment?
I think we'll talk about that when we are talking about management maybe, but I don't think it can be treated. It is just managed. Like having issues with the sun and eyes. I think you just manage them. So we'll talk about vitiligo. Vitiligo is not very far away from albinism. It is still a condition affecting the integumentary system. And vitiligo, it is a long-term condition where the skin loses its color. It happens when the cells called melanocytes die or stop making melanin. So melanocytes, the cells that make melanin, are destroyed or they stop making melanin. So the problem in vitiligo are the cells themselves. They're either destroyed or they stop making melanin. This results in smooth, milky white patches on the body. So the difference with albinism and vitiligo comes with the patches, localized patches. It is not everywhere as albinism is. Albinism will cause the entire body to become pale. The hair, the whole of it can become whitish or pale. But vitiligo now comes with that localized patches, whereby you find some parts are pale, some parts are normal. And I hope we have seen people with vitiligo. What are the signs and symptoms of vitiligo? We can have white or light patches on the skin, as we have said, often on the hands, feet, arms, and face. So white or light patches. Other signs, we have hair turning white in areas where the skin loses its color. So hair can become white, but it is localized, not the whole of it. We can also have loss of color inside the mouth or nose. What are the causes and triggers? What are the causes and triggers? The first and the main cause, of course, it is autoimmune response, whereby the body's immune system attacks and destroys its own pigment cells. And we talked about this. The immunity is fighting its own cells. It has maybe confused and starts fighting its own cells, of which are the melanocytes. They can also be caused by genetics, whereby changes in genes can make a person more likely to get the condition. Yes, so those are the main causes. The triggers, we can have stress, severe sunburn, or toxic chemical contact can start or worsen the process. So remember, those patches, they can spread or change as you grow up. And these things don't come at birth, not like albinism. Albinism is majorly genetics, so you will be born with it. But vitiligo, it comes as you grow. Most of it comes as you grow. And it starts as small patches. It can spread. It can change location. So that is vitiligo. And we have types of vitiligo. The major two types. We have non-segmental and segmental. Non-segmental is whereby patches appear on both sides of the body in a matching way. I don't know if you have seen people who have that non-segmental vitiligo. They match. If you have a patch on this right side, you'll have another one that matches with it. If you have a patch on your right hand, probably you'll have on the left. They kind of match. But again, we have segmental vitiligo, whereby the color loss happens only on one side or one specific area of the body. So those are the two types of vitiligo. And these are the skin conditions, not just skin conditions, conditions affecting the integumentary system. So I think we'll finish it there. Thank you.